Now we will call to order the regular meeting of the Watsonville Community Hospital Board of Directors. Rosie, please give us a roll call.
Done. Director Cox,
Here.
Director Friel,
Here.
Director Gallagher,
Here.
Director Pimentel,
Here.
and Chair Nunez.
Here. There's nothing to report out of tonight's closed session. I'll now ask for any agenda modifications for consideration from staff for tonight's meeting. Nope.
I will note that there was supplemental effect. Cheryl's put it here.
Are we not adding an agreement for the radiology services provider? No. Okay, seeing no agenda modifications for consideration, I'll now ask for public comment on matters not on tonight's agenda for the Potter Valley Healthcare District Hospital Corporation, so known as Watsonville Community Hospital. That's items not on tonight's agenda. I'll go online first. Any raised hands online looking to speak on items not on tonight's agenda?
I do not see any hands raised online.
Okay. Anyone in the public wishing to speak, please? Go ahead. Yeah, we'll give 2 minutes for speakers.
Are you guys ready?
Yes.
Okay,
You're
thank
ready.
you. Good evening. My name is Roseanne Ferris. I'm a nurse here at Watsonville Hospital in the critical care department, and I'm the chief nurse rep for our nurses union, CNA. I come here this evening with gratitude for all employees, stakeholders, guardians of the hospital who helped keep the doors open and deliver excellent care to our community. Through many different ownerships, bankruptcy, the pandemic, and now faced with the next storm. With federal cuts to the tune of $880 billion to Medicaid and other cuts to follow, and our safety net hospital dependent on these Medicaid patients, 73% of our population falls in that group. To say we are concerned is a dire understatement. In both talking to and hearing from our elected officials, it is clear that they share this concern. We have raised this concern to our management team. Now we bring it to our district hospital board. We need to come up with a plan that is proactive and not reactive. By no means are we saying that we need to freeze progress, but at looking at where we are spending might be a good place to start. We as nurses will continue to fight for safe healthcare for our community. Thank you.
Thank you. Anyone else wishing to speak on items not on tonight's agenda? Thank you.
So my name is Valerie Pansich and I work in the CCU. I've been at Watsonville Community Hospital for 12 years, which is actually Skittles compared to those who've been here for much longer. Before coming here, I worked at hospitals in and out of state that were larger, more equipped, and just fancier overall. But something was lacking. There was something amiss when I walked the halls or sat eating in the break rooms. When I finally decided to come home and work at my hometown hospital, I knew it was probably my last. And it was actually the best. I found what was missing, the community. And not just the one inside, but the whole thing, the community within these doors and outside of them. And from them, I found my place in it and have made it my purpose to offer what I can to serve it. Tonight that comes in the form of questions and a big thank you. My questions are, how is this hospital preparing for the discussed Medicaid cuts? How will you ensure our community has the care it needs? And when will you reassure us that you're actually thinking about this by writing us and letting us in and communicating? My final purpose here tonight is the thank you. From the bottom of our broken hearts, thank you, Matt. You've always been our guiding light through all the tumultuous times, the captain of this ship, navigating the roughest of seas. Having devoted your life to this place and us, I can only imagine this was not an easy decision. No, we will miss you and can only hope that you will return home to us someday. Thank you for your years of service, Matco. We wish you well.
Thank you. Anyone else wishing to speak on items, please?
No other nurses? Good evening, senior administration, elected board, nurses, community. I'm Teresa Mack. I'm the labor representative of the California Nurses Association. The cuts are dire, the pending cuts. The nurses and I have certainly, from the halls of Congress just a few days ago, in all of our communities in the Central Coast and across California and the United States with our National Nurses United nurses that are not in California. We have certainly been standing up to speak out, to demand that elected officials not allow this to happen, to take a stand. You're all in healthcare. And I know we already talked to Stephen at our nursing practice monthly meeting and Phyllis the other day, but the nurses are extremely concerned. I know you all know it's just gonna hurt and impact our most vulnerable patients. That's most important. But what I would like to say on behalf of the nurses, behalf of that fantastic community, these nurses, those of you that were involved, saved this hospital along with the community and along with CNA's help as well, humbly. This is dangerous and I know all of you know this. What we're saying from our part is we are going to reach out, as a union, as CNA to elected officials. I had a chance to, and so did Roseanne briefly at an awards dinner, get a chance to talk to our senator, Laird the other day briefly. And we're going to be at California, Sacramento Lobby Day, but really this is the federal government. And so we're going to be out there protesting on May Day, on May 3rd, and doing everything we can. But we are calling on you guys, please do not, let services be cut. We can't do that to our community. And that would put you guys in direct conflict with us. So I hope that is not something that you're even thinking of.
Thank you. Thank you, Teresa. Anyone else wishing to speak on items not on tonight's agenda? Any raise hands online? Anyone raise hands?
No hands raised online.
Okay, with that, then I'll close down the public comment for tonight's agenda and open up to comment from our board members. Well, I'll first go to Alex. Alex, anything that you'd like to add here?
No, not at this time, thanks.
Okay, thank you. Any comments from our board members here? Please.
Yeah, I'm probably still rocking my day job a little bit. With County Santa Cruz, we're also struggling with these same ludicrous ideas. And one thing we're making sure everybody understands, there's a lot of issues now that were it not for Washington DC, our economy wouldn't be acting the way it is. If we're not for Washington DC, our healthcare wouldn't be at jeopardy. There's a single unified group that's doing this. Is not an organic thing that's happening in our economy. And that's the most frustrating thing about all of this. And it's going to be something that I appreciate. Collaboration and partnership. Everybody's here today and everybody's watching. So it's going to take that, a unified voice, and that will threaten their mindset. But I just appreciate the comments here today, but I also know there's a lot of other people that have the same feeling. And I think we're all unified and focusing on how we protect this community and the healthcare that's essential for it. And we're thinking 1 in 3 people in this community lose coverage. That's not even something that we don't even think is possible yet. That's a likely scenario, not likely. it'll pass. That's one scenario. So I want to stop myself from talking, but I just want to say thank you for everybody being here, and this is real, and I appreciate the collaboration and all the work everybody's doing.
Thank you. Sure. I also have a few comments, but Director Gallagher or just a few comments. This is our last meeting before we come up on a few notable national days of recognition and weeks of recognition. And so on May 6th to the 12th, we are National Nurses Week and National Hospital Week. And so just to echo the comments from Director Pimentel, just thank you to our nurses. Thank you to all of our hospital employees for everything that you do. And I hope that we take some time from the administration to celebrate all of our incredible nurses and our employees at the hospital and during that week. Also, just want to say a big thank you to all of those who attended the State of the Hospital on April 18th at Watsonville Community Room. Steve and Allison and Nancy did a fantastic job, and June, of course, putting on that event and coming together with our community and our community partners and giving everyone an update about where we're at with certain initiatives in the hospital and some of the challenges that we are facing. The other thing is, I think you hit the nail right on the head, Director Pimentel, that yes, we do see the reports. Yes, we see them happening every single day, and whether they're coming into our email box or they're the first thing that we read when we open our cell phone or as we're listening to podcasts or whatever it might be. We understand that what is being proposed, both at the federal level and then also at the state level, is going to have massive impacts throughout our community. It's not a question as to how our community is going to be impacted. It's just, or whether our community is going to be impacted, but exactly how it is. Yes to everything that we just said. Yes to partnering with our labor unions and our staff, our administration, our community partners to figure out how we lessen that impact and how we continue to provide the service that we're providing now, if possible. We know that this is, as Mark has said, not an issue that should fall on political lines. Does not matter who you voted for, does not matter what you believe in or who you believe in. These sorts of cuts are going to impact across every single community in the United States. And so we're working very closely with our community partners, with our advocacy partners, and we are advocating in the same way that all of you are as well too, to our state and our federal representatives to ensure that they understand that these budget cuts, that these proposed cuts are going to have massive impacts on the people that make up these communities. We've already seen some of those, some of the cracking in the political shell, as I'd like to say. Recently, we had 12 Republican lawmakers in Congress write a letter to the folks putting together the budget, have budget hearings saying that they will not stand and will not vote for a budget that has any sort of cuts to Medicaid. And so we're seeing already the cracking in that Republican shell and the political shell. And so we just have to continue the pressure and ensure that we're putting people above the politics that is happening at the federal level, understanding that this is going to hurt all of us. It does not matter who you voted for. So thank you for being here and thank you for your continued advocacy and partnership. With that, I'm going to close down the comments from our board members and move on to our consent agenda items. We have two consent agenda items, and it is number one is our minutes approval for our previous meetings on March 26th and March 27th, and then also our policies summary approval. I'll first go to the board and see if there's any questions on either of these two items before I open up for public comment. Seeing none, I'll now open it up to public comment for our consent calendar. Rosie, any raised hands online?
No hands on mine.
Anyone in the public wishing to speak on either of these two items? Okay, seeing none. Yeah.
Phyllis, thank you very much for the rewrite.
You're very welcome.
And the line by line here are the changes. In a sense that it's under the surgery department, I understand administratively, it's under the surgery department. The cardiologists are part of medicine. I'm not sure what the solution is to make sure that whether it goes to both departments, et cetera, that'd be my suggestion. I'm happy to vote yes for what's here, but that was my,
Okay, so I'll open up to public comment. Anyone wishing to speak on either of these two items? Okay, seeing no public comment, I'll close it down and I will entertain a motion.
I'll motion approval and I'll sneak in a comment of, boy, does everything look nice with our logo on it.
Do I have a second?
I'll second.
I have Pimentel and Cox. I'll take roll on this item. Director Cox,
Yes.
Director Friel,
Yes.
Director Gallagher,
yes,
Director Pimentel,
Yes.
and Chair Nunez.
Yes.
Thank
Okay, that'll, I'll move on from the consent calendar to our discussion items. Our first item for the hospital corporation tonight is the medical executive committee's report. This is a report that we received in closed session. Before I open up to public comment, do we have any questions from the board or staff on this item? Okay, seeing none, I'll open up to public comment. Rosie, any raised hands online for item number 3?
No hands online.
Anyone in the room with us wishing to speak on item number 3? Okay, seeing none, I'll close down the public comment, and I'll entertain a motion on item number 3.
I'll move to approve the MEC committee report.
I'll second.
Thank you. Directors Cox and Pimentel. I'll take a roll on this item. Director Cox,
Yes.
Director Friel,
Yes.
Director Gallagher,
yes,
Director Pimentel,
Yes.
and Chair Nunez.
Yes.
Thank you.
Okay, we'll move on to item number 4, and it's the chief executive report. Steve, whenever you're ready.
All right, thank you. So while Rosie is pulling that up, I will direct your attention to the plants and cards that are in front of 4 of you. And Alex, we have yours for when you get back. This is for Board Appreciation Month, week, day, and we just wanted to say how much we really appreciate our board members and the passion that you all have and the time that you take out of your days and weeks and evenings to come be with us and come help us drive our strategy, be out in the community, talking up all the wonderful things that our staff and our teams are doing and supporting us and helping us raise funds and all of the things that you do on a day in and day out basis. So the plants are to symbolize the thank you that we have for you coming and helping us grow. I didn't make that.
thank you.
Okay, so I have a few things that I want to talk about after that, and we'll talk about the dashboard, some of the advocacy work, so following up on some of the public comments that we heard earlier, and then OCA, and I'll tell you what that stands for when I get there. Before we get to the dashboard, I did just want to say again, thank you to those Allison, Nancy, June, and others who helped us put on our first State of the Hospital event. We had over 120 people, double figures in elected officials and their representatives who were there, multiple media outlets. We got some really nice media coverage from the event, which I thought had a good balance of what we were trying to project, which was celebrating the wins that we've had over the last 2+ years, 2.5 years as a healthcare district, and balancing that with the challenges that we still face, right? We're still not out of the woods financially. We still have those challenges, and we have all of the federal and other cuts that we are looking at and that are facing us and all other social services in the community. So we have that. And I thought the articles in the Sentinel and Lookout did a nice job of representing those both sides of that coin. And thank you to those who spoke. So here's our dashboard. This is the part where you just have to squint and you can see the red and the green and the blue. So we have a little bit of all of the above, and then I'll zoom in so that you can see the individual areas. So our hospital inpatient survey, patient experience survey continues to be between the 50th and the 75th percentile nationally. So we're at about 74% of patients who are saying they would definitely recommend the hospital to friends and family, which is about between the 60th and 65th percentile nationally. Our safety priority index, which is our hospital acquired conditions, the things that we try not to have happen to patients, where we had over 30 of those a couple years ago and we had 15 last year. The rolling 12 months right now, we're at 11, and we've had 3 of these year to date. And so we're on a really nice trajectory. That improvement that we had last year was over a 50% reduction, and we're have another stretch goal this year to have another 50% reduction. I think we can actually achieve that if we keep this up. And if we look at this chart here, it shows where those hospital acquired conditions have happened. And again, kind of just looking from a color standpoint, there's a lot more green on the right these last 7 or 8 months than there were on the left the previous 7 or 8 months. So that's a really awesome trend that everybody here should feel really proud of, that we're keeping our patients safer and safer every day. Just 3 events in the last 7 months is pretty remarkable. 8 months. On caregiver safety, we are having a little bit more of a challenge there. So we've, with the help of our nursing partners, stood up a robust workplace violence prevention committee, because that's where we are seeing some increases in injuries to our staff, is patients lashing out either because they're having a behavioral health challenge or because they're on certain medications that are making them less lucid as far as their behavior is going. And we need to do a better job of keeping our staff safe from those types of injuries. And so we've had some of those have increased. I think we've also gotten better at identifying those and reporting those and making sure that people are aware of them. So the Workplace Violence Prevention Committee is doing a lot of work around awareness around patients who may have those tendencies, so that anybody who goes in that patient room will be aware and can take the appropriate precautions. As far as staff retention, we do have some good news there. So we've improved actually from the 75th percentile nationally to the 90th percentile nationally. We're at an 86% annualized retention rate for the last 12 months. So I think that's pretty tremendous. And we got those are national best practice benchmarks that we're looking at. On our patients served, it's a mixed bag. We're well above our budgeted target for outpatients served, and we are behind where we were last year on inpatients. So our outpatients served, we're almost 23,000 people have been served through the first 3 months. So this is January through March in the lab, ambulatory surgery, special procedures, radiology, wound care, and outpatient rehab. So that's about 7% ahead of our budget for the year. For admissions, which includes acute inpatient admissions as well as observation admissions, we're just about 1,005, whereas last year we were at 1,031. So just a small tick below where we were last year, but about 10% below where we had budgeted. A lot of that is in much of that is in the cath lab, which will be opening soon within the next couple of weeks, but hasn't opened yet. And then Julie will talk a lot more about where we're at with cash flow from operations. Financially, we are about 3.4 million behind budget. We improved a little bit in March. This number did come up from the February dashboard, but it's still not where we were at. So we're still trying to play catch up from January and February. One piece of good news on the both financial and volume patient served front is our patients coming from the new Kaiser Salinas expansion. So when Kaiser expanded their coverage to areas of northern Monterey County, they They used us in their application to the Department of Managed Healthcare as their hospital for Northern Monterey County, because we do serve that population as well. And so that allowed them to start, open up their medical office building in Salinas. And in doing so, those patients have been coming here. So on the inpatient side, the numbers are still in the single digits for inpatients coming from Salinas, with Kaiser. But the outpatients have just about doubled from January, February, and March of last year to January, February, March of this year. With about 50 to 70 outpatients coming to us each month from Kaiser Salinas. So that's good, good news, and continuing that good partnership that we have with Kaiser. On to community health and advocacy. So this is one of our strategic priorities of the healthcare district and the hospital, is to be an advocate for our community and for our community's health. And so we have been doing that. I appreciate all the comments and public comment earlier, because we're right in lockstep with that work. So we've participated in a handful of press conferences over the last couple of weeks around the federal actions that are coming around the health inequities that are still in existence in our community in the Pajaro Valley compared to other parts of Santa Cruz and Monterey counties. And we plan on having another press conference specific to Medi-Cal cuts. It says on this slide 5.5, but I think it's going to be 5.12. And it's going to be right here at the hospital. So we're actually going to host that particular press conference and have other members of our nonprofit community and healthcare community coming together to raise awareness about what we're seeing, what we're doing, and what we need to do, and what the community needs to know and understand about any potential cuts that might come our way, and to help keep the pressure on our elected officials to try to prevent those as much as possible. We will continue doing that work. It's really important work. The Office of Healthcare Affordability, that's what OCA is. So this is an office that was established in 2022. The members of the board of OCA were appointed by the governor, so there's not elected folks, these are appointed members. The office seeks to establish spending targets for California healthcare as a means of slowing the cost increases for residents as it relates to their healthcare. And so they've chosen to start by establishing a hospital sector. So that will be the first sector that receives cost increase limits. Was really fascinated a number of months ago how they proposed to do that. And they've started over the last couple of months to put that into writing as far as how they would measure that. So they're seeking to limit hospital spending by measuring the commercial inpatient net revenue per case mix adjusted discharge, which essentially is how much we're getting paid by our commercial payers, right? So it's not how much we're getting paid by Medicare or Medi-Cal, and it's technically not how much we're actually spending on the care, which would be our expenses and our costs. It's how much the commercial insurance companies are paying us or paying providers. That's how they're measuring it. Most hospitals' targets from OCA will be 3.5%, meaning if they will essentially be asking hospitals to not ask insurance companies for more than a 3.5% increase on our payments on a year-over-year basis, starting in 26 and phasing to 3.0% by 2029. They've identified 7 high-cost hospitals where their targets will be 1.8% going down to 1.6%. We are not one of the high-cost hospitals. In fact, we are, if you look at the publicly reported data, we're about 18% more affordable to Medicare than the average California hospital. But there are hospitals near us. There are actually 4 hospitals within a pretty short driving distance of us that are among those 7 select high-cost hospitals. So those hospitals are dealing with this additional scrutiny by the Office of Healthcare Affordability. Remains to be seen exactly how this is going to impact our finances, how it will impact our negotiations with payers. I'm sure the payers will point to this and say they can't, right, give us more. And, you know, it really, the commercial insurance is really what helps us make sure that we can pay for all of the significant losses that we have on Medicare and Medi-Cal. So the choice here of how they're measuring this and how they're holding organizations and hospitals accountable to this is a curious one. And any kind of fines or fees or penalties related to this wouldn't go into effect for a few more years, but they'll certainly start looking at it in 26 and 27. And it's gonna be interesting. This is another thing that we're talking to our elected officials about, although it's much less prominent on their minds. But it's certainly something that I want you to be aware of, and I'll keep you posted as we learn more about it.
Curious is a good word.
Yeah, I try to be friendly. Yeah, it's so I can take questions, and then I know Phyllis and Matco will have some updates as well.
I'll go to Alex first. Alex, any questions before we move on to, I think, the nursing update?
No, not at this time.
Do we understand this appointed board by the governor seeking a higher seat in a few years? And needs campaign funding. Do we have a sense of what are they really? What is their authority to implement this?
Yeah, so they're part of. So their authority is vested under HCI, which is our regulatory body. So I don't know, probably have to look to our Director of Government Affairs to understand that a little bit better. We probably have to lean into that a little bit more, but I think they're advising HCI on how to hold hospitals accountable to costs.
Thank you.
Any other questions? That's a comment. It seems sort of untoward for the state to try to regulate private insurance rates or our attempt to increase our, so just, it's a comment.
Agreed. We're gonna move on to the nursing update now.
Okay, good. Well, first off, thank you, Tony, for recognizing Nurses Weekend Hospital Week. We have lots of fun activities planned and looking forward to it. One of the great things that happens during Nurses Week is on the 7th, we are having a soft launch of our palliative care program with a lunch and learn. And our own Janet Nagamini, who is our medical director for palliative care, will be speaking, and it's introducing our facility formally to our palliative care program. So I hope you all are available. We would love to have you. It's lunchtime on the 7th, and that is happening not coincidentally during Nurses Week. So really celebrating this great and innovative program that we're bringing to our patients. A couple of other things. I had the privilege of pinch hitting with the Health Collaborative Partnership and the Health Trust, really focusing on equity in nursing and equity in healthcare in our community. Had some great speakers, including the public health department were there, and had a lot of energy and enthusiasm in the audience. That was really fun. This, interestingly, as it is Board Recognition Month, it is also Volunteer Recognition Month. And so we were able to celebrate our volunteers this week, and thank you, Dr. Gallagher, for coming by. We are numbering over 25 of volunteers, which is a tremendous increase. Over a year ago, we were down to like 10 or 12. So there's a lot of enthusiasm, a lot of energy in that group. I know you've all seen them at the front desk, but we have them out delivering mail, and we have them managing a clothes closet for both infants, children, and adults. So that's pretty cool. And the big news, we are working on getting our cafe open with the support of the volunteers and Matco and Susan, which is going to be well received, I think, by all of our staff and our community. So we're super excited about that. I think that's pretty much it for me. I'll get to Matco.
Thank you. Brief report for myself as well. We've met with 3 different providers over the last month, a GI, a pulmonologist, and ortho on the CHP side. One of those was on site for a tour, interested in potentially joining our call panel on the GI side. The pulmonologist is interested in exploring and understanding coastal healthcare a little more in depth. And the ortho provider is somebody that Lupe is working on recruiting for still the role that was vacated previously. On the facilities front, we'll have a speaker later in the district meeting from American Energy Partners. Michelle Murphy will be presenting the LED project that she's been working on. Richard and the team completed the infant induction system upgrade last week. So facilities, biomed, IT all collaborated with the vendor to get that upgrade completed and online. We've engaged Mint Systems on the solar project planning, and that's starting already. And yesterday was our kickoff meeting for the ED expansion project as well. So a small group initially met with the architects to talk about some of the changes we'd like to make and start working on that on a regular basis to get that planning done. And then on the radiology front, Nelly and team are finalizing the quotes for the bond project that'll be funding the MRI and CT, the MRI upgraded CT install. So that is going to be coming to you soon.
Exciting stuff.
Alex, any questions for Matt?
Not at this time. Thank you.
Any questions for Matt for public comment here? Okay, seeing no questions from the board, I'll open up to public comment on the Chief Executive Officer report. Rosie, any raised hands online?
No hands online.
Anyone wishing to speak on the CEO report? Seeing no raised hands, I'll close down and we can move on to item number 5, the Chief Financial Officer monthly financial report update.
Okay, so a couple highlights. As Steve mentioned, March was a better month for us than January and February had been. Although we did miss what we had budgeted by about 443,000. And the majority of this really relates to the soft volumes that we've seen and that he pointed out in the dashboard. You know, the inpatient volumes have been less than we projected. And the fact that we have not opened up our cath lab, which we had some outpatient volume in there as well. Those are really the main contributors. You will also see later in the slides, you know, some of the payer mix impact just in watching the shifts month to month. Expenses are favorable to budget. We are doing, you know, appropriate flexing and seeing less cost in supplies. You can only do so much when volumes are low. You know, we do have core staffing. We recognize the need to keep the base staff on, even if the volumes are lower than we projected. So the favorability just doesn't translate as quickly as the loss in revenue does. And we are still looking forward to the CQAP, or the Hospital Quality Assurance Speed Program 9. We're currently in Program 8. This is where we draw down the federal funds for Medi-Cal, as we've been talking about patients. You know, this has been an approved programs with multiple cycles since 2009. There is a CQAP 9 that's on the table. It's been presented. It's going through kind of CMS review now. Probably take most of the year to actually get formally approved. We're not hearing of specific cuts to that program, but of course, everything that we talked about with the budget impacts, you know, if there's less Medi-Cal patients, there could be a direct correlation to that program. But we do have some expenses budgeted that we have not yet had to expend. So this is what we look like on a month-to-date basis. Favorable EBITDA of 68,000. Overall net loss of 102,000 because we have our depreciation expense and our lease, which deals with various small leases, like equipment leases and things that we do, and some interest expense on the bonds. Next slide. So on the year-to-date basis, you really can see that the largest impact that we're having in a $3.3 million year-to-date loss is on the net revenue side, and it really is, you know, primarily volume, as I've spoken to. Most of the expenses are favorable, and the ones that are unfavorable are just slightly unfavorable. Next slide. From a statistics, here's getting a little bit more details on the stats. So for the month, we were about 89 admissions below budget. That's pretty significant. You'll see when we see the year-to-date that that's a good chunk of the year-to-date. The other thing, you know, the census, we ran 27.8 patients per day, and we were budgeted for 37, so almost, you know, 10 patients below budget. Length of stay has been good. You know, we tend to manage length of stay very well, thanks to, you know, the good care coordination from our case management team and working with the providers to keep patients here really only as long as they need to be here. Case mix has been, you know, softer this year, especially this month. It fluctuates from month to month, and there is some of what's built into our budgeted case mix is in anticipation of the cath lab coming on board, of us, some of the work we're doing with physician groups so that we have more intensivists in-house and the appropriate call coverage to actually keep higher acuity patients. So there is, you know, still some room for that to raise back up, as well as behind the scenes efforts that go into the querying and making sure that we're capturing appropriate physician documentation to support the right level DRG for the patient, and thus the right level of reimbursement. This was the first month in about 7 or 8 months where deliveries kind of fell back below budget. I have a slide later where you'll see the trend. Hoping that's just kind of a 1 month drop, because we really have been on a nice increasing pattern for the last 7 or 8 months. Inpatient surgeries, on the other hand, actually exceeded our budget expectations, and, you know, has been fairly strong compared to budget the first quarter of the year. And outpatient surgeries, well, we were off by 20. That really is cath lab that's not open, because we had about 20, 25 cath lab procedures in the budget projections for this month. And then overall, as Steve's slide had showed out, outpatient volumes are exceeding our targets. This month, ER visits were down a little bit, and they were below budget by about 250. But I think still on a year-to-date basis, they're pretty close to budget. So here you can see the year-to-date admissions, and you can see, you know, the year-to-date statistics, you know, 112 admissions, and below budget. I said 89 of those were in March alone. And average daily census of about 32 for the year. You can see delivery is kind of right on track at 212. You can see the case mix here on a year-to-date basis, a bit higher, a bit closer to budget than the month of March was. And that the inpatient surgeries are actually exceeding budget by 23. Outpatient surgeries below a budget by about 95. I'd put about 70 to 75 of those probably in the cath lab bucket. Next slide. Admissions, when you look at the trend, you know, while there are some ups and downs in a few months where we get up to, you know, 309, 321. This month was kind of on the lower end at 251, but across the trend line is pretty straight and pretty flat. Next slide. Here's the acuity. You know, it has gone down slightly over this 13-month period. And I think as we shore up some of the call coverages, the intensivist agreement, you know, getting the cath lab up and running so that, you know, there are potentially some higher acuity patients that come out of that service line, I think we'll start to see this climb. Average daily census you know, a very slight decline, really probably drugged down some by the March census. So if we get that growing back up, I think that's gonna flatten out. Outpatient ED visits, orange is your ER visits. Slight downward trend, but really pretty insignificant. And, you know, I think 1 month would probably flatten that out pretty quickly. And then the non-ED outpatient visits is a slight increase. And, March was, you know, a really pretty busy month with over 3,600, non-ED outpatient visits. Here's a delivery slide, and what you can see here is it was really on a pretty nice upward trajectory since June of 24. And, you know, March fell off. March is definitely lower than it was last March. But, you know, sometimes it's just which month is that real big month. And March last year happened to be one of those real big months with 80 deliveries. And I usually think when we're in the mid-60s to 70s, you know, that's kind of our target area for most months. Here's the total surgeries, and the orange on the bottom is your inpatient, blue, the outpatient. So, you know, total surgeries fluctuates a little bit, but kind of the proportion generally is pretty similar month over month. Here's the payer mix, which is really the other kind of piece besides volumes that can contribute to the net revenue and being below budget. Our inpatient, you know, focusing the commercial, which is, you know, often subsidizing what we get paid for, and the governmental, we were at 15.9%. You know, our higher months, we tend to hit 18%. Lower months, we tend to hit, you know, 13, 14%. So we're kind of middle of the road, leaning a little bit upwards. And I think as we saw in Steve's slide about the Kaiser volume and trying to, you know, get more of that and seeing more of that from Salinas, that's definitely something that can help push up this commercial mix. The yellow there is our managed Medi-Cal or the Alliance. You know, they typically are always between 40-45% of our inpatient mix. They were 39% for the month of March. And then the blue at the bottom is fee-for-service Medicare. And this month we were pretty strong at 29.5%. Occasionally we get over 30%, but a lot of times we're in that 27 to 29% range. Next slide. On the outpatient side, it doesn't tend to move quite as much. We were at 22.9% for commercial mix. Again, that's kind of middle of the road for us. We can sometimes get up closer to 24.5 or so, 25%. The yellow again is our Alliance, and they're at 46.8. And they're, you know, they're often getting pretty close to that 50% mark of our outpatient ED. A lot of times, if I look just at the ED, I should say that's where it can get close to 50% of our ED patients coming from the Alliance. And then we were at 19.9% in the fee-for-service Medicare at the bottom. Again, pretty much where we tend to hover. So that's what I have to report, and I'm happy to take any questions.
Any questions for Julie? Alex, I'll start with you. Any questions?
No, thank you.
Any questions from the rest of the board for Julie?
Okay.
Okay.
Appreciate the details in the team. That report.
Thank you.
Just want to compliment you, diving down into the number of data hotels or seeing the trends in the data. That's been really helpful for modeling and it's been great to see the budget get fine-tuned. So there's a lot of good work here happening, and it's nice to be able to see the trends pop out right now, right? So I recognize how hard it is to be reporting so quickly. I appreciate that. Do you have a question about inpatient surgeries? How maybe it's my ignorance in the space? How far out? Like typically, are those what percentage of inpatient surgeries in the next 3 months or something that are planned and what are stuff that just happens like? Or most of the inpatient surgeries, things that are planned and predictable, that we can see those hitting the calendar that we see June is gonna be a good month or how's that? Just from a flow standpoint.
I really can't speak to that because I haven't looked at what percentage of the inpatient surgeries are planned. You know, certainly the outpatient ones, you, a little bit more predictability
yeah.
because you're scheduling those.
Yeah.
But I'm sorry, I don't have that.
C-sections are planned, so C-sections are part of the inpatient surgical volume, so those are certainly planned. A lot of the others are incidental admissions through the ED for gallbladder exacerbations. So I would say the majority of the planned surgeries are scheduled C-sections.
Any other questions? I just have one, Julie, I think in the inpatient admissions, if I remember correctly, the payer mix, I think we had 2 months now under 1% for self-pay. Just from your perspective, what does that look like for us in terms of people coming in, fewer people coming in with self-pay? Is that a good work from?
It's not really fewer people coming in for self-pay.
Sure.
Patients that come in without insurance, we immediately, we work with a vendor to try to get them eligibility to Medi-Cal or onto the Alliance. So, and they're pretty successful as long as the patient's willing to be,
Right.
you know, to go down that route. And, you know, we do recognize that there's some, you know, could potentially be some fear of going down that route. But that's what really keeps is a lot of times for the actual visit, we can get presumptive Medi-Cal, which basically just kind of treats that visit and a little bit of time around it. And then that buys us the time to actually go get, you know, full scale Medi-Cal for the patients.
And then seek reimbursement for the service.
And yes.
Okay, I am gonna open up to public comment. There's no other questions. So Rosie, any raised hands online for public comment for the CFO report?
No hands raised online.
Anyone wish to speak on this item? Okay, seeing no raised hands, I'll close down the public comment. Julie, thank you. And we'll move on now to item number 6. And this is the Colorado Valley Healthcare District Hospital Corporation Employee Engagement Update and Chair, Vice Chair, and Member Appointments. It says here that the presenter is Margaret. Do you want me to do it?
Surprise.
Yeah, so we've had some good early preliminary meetings and have identified thanking those members of this committee who have rolled off. The committee appreciates all of their work and efforts and now suggests to appoint Director Gallagher as the committee chair, Director Pimentel as the committee vice chair. The appointment of Margaret Morgan, the interim director of HR, Matt Branges, Phyllis Stark as members of the committee, along with Valerie Panzich, who works in the ICU, Kristen Palmquist, who works in education, Gregory Gaboni, who works as in surgery, and Roseanne Ferris, who works in the ICU as regular committee members, and Trina DeMar, nursing supervisor, Robin Cosby in facilities, and Louise Pierce in the ICU as alternate committee members.
Okay, any questions about the appointments or about the recommendation before us? Or our chair, vice chair, proposed vice chair, and any additional context that you'd like to give to the appointees?
I think the motion as stated is accurate. The other activities that we've had, Director Pimentel gave a presentation on the Brown Act, and we've had some initial discussion about the scope and work plan. Those are sort of things to take up in the near future, and we have another meeting for June. Date not set, but for June, meet every week.
Great. You think?
Let's know appreciate the chair of the committee, thank you. But it would involve that we get an employee ask for interest in participating in this committee, and I was glad to see that, I believe everybody who had an interest, we were able to find a role and purpose. So thanks for everybody who agreed to sit on this. I support the recommendation.
One other comment, it'll come out in the work scope and work plan, there's some details yet to go, but having alternates would let us have more. Right, people, when someone's not present, an alternate steps in as a voting member. How we exactly do that is yet. That's the reason for the alternates. And it also lets wider expansion or exposure of the committee to it.
Alex, any questions for staff or for the,
No, I think it's a great committee, so.
there's no other questions from the board. I'll open up for public comment before I come back for a motion. Any raised hands online, Rosie?
No hands online.
Anyone wishing to speak on this item? Okay, seeing none, I'll close down the public comment. I'll bring it back to the board for a motion on item number 6.
Move as stated.
I'll second.
That was Directors Gallagher and Pimentel, I believe.
Yes.
Thank you. I'll take a roll on this item. Director Cox?
Yeah.
Director Creel?
Yes.
Director Gallagher?
Yeah.
Director Pimentel?
Yes.
And Chair Nunez?
Yes.
Thank you.
Thank you. We'll move on to item number 7 now, the Da Vinci
Next side.
XI.
Yeah.
Am I wrong? System second lease amendment with Intuitive Surgical Inc. Matt?
Thank you, Tony. Again, the request is just to extend, essentially amend the agreement that we did back in 2022 to extend the lease of the robot for another year. Rates remain the same. Volumes have been increasing, flattened out a little bit, but tend to fluctuate month to month, but generally growing overall. So the request would be to keep the robot and extend the agreement for another 12 months.
Okay. Any questions for Matt about this agreement terms?
Questions, Matt, do you know if there's the ability to go beyond 1 year extension, or is this really, this is our preference?
This is what's available to us currently.
Any other questions for Matt before I open it up for public comment? Okay, Rosie, any raised hands online for public comment on this item?
No hands raised online.
Anyone in person wishing to speak on this item? Okay, seeing no raised hands, I'll close down the public comment. I'll bring it back to the board for a motion. Jump all at once.
I'll move to approve.
I'll second.
Directors Cox and Pimentel, thank you. I'll take roll on this item. Director Cox?
Yes.
Director Creel?
Yes.
Director Gallagher?
Yeah.
Director Pimentel?
Yes.
And Chair Nunez?
Yes. Okay, we'll move on to item number 8. It is the LifeLink Third Amendment to Anesthesia Services Agreement. We got that one right. Matt? Whenever you're ready.
Thank you. So this is an amendment to our existing LifeLink agreement, who's our anesthesia services provider. As you know, we talk about anesthesia quite a bit. Really looking to stabilize that service. Challenge has been increased rates amongst providers, and then the challenge of securing providers. So we believe this amendment will allow us to stabilize the service in 2 rooms in the OR 5 days a week, in addition to our typical call coverage. Rooms would be 12 hours for both rooms, so 7 A to 7 P, with call coverage after that, and then continuance of call coverage in the OP on a 24/7 basis.
Questions? Yeah.
Matt, do these numbers include Dr. Harold? Or is he in addition to you?
No, this is inclusive of all the providers that service our one from the anesthesia standpoint.
Was it a possibility to go 3 providers from 7 to 3 and 1 provider from 5 to 7, or no, that just wasn't?
We have an option to add providers with ample notice as a 3rd room. So, yeah.
Okay, any other questions for Matt, before we open up for public comment on this? Okay, seeing none, Rosie, do we have any raised hands online?
No hands online.
Anyone wishing to speak on this item? Okay, seeing none, I'll bring it back to the board for an appropriate motion.
I'll move approval.
I'll second.
Directors Pimentel and Cox, thank you. I'll take roll on this item. Director Cox,
Yes.
Director Friel,
Yes.
Director Gallagher,
Yes.
Director Pimentel,
Yes.
and Chair Nunez.
Yes. Okay, with that, we'll adjourn our regular hospital meeting, or a regular meeting for the Watsonville Community Hospital Board.